Hello, Namaste. I welcome you all to the 101st session of Gurubodha. I welcome you all to this session, and on behalf of us, all of us students, I cordially welcome Dr. Guraja sir to this session. I also cordially welcome Dr. Raghuram sir to this session. This session is brought to you by easyayurveda.com. I dedicate this and all of my works at the holy feet of Dr. A. Chandrasekhar Udupa. So, coming to the topic of the day is the herb Arka. In the last class, we discussed about how Arka or Calotropis is useful in digestive disorders, it being used in many diseases as an ingredient for in many medicines, especially the digestive disorders. Not only that, Arka or Calotropis has its uses beyond just the digestive disorders. I request Guraja sir to take us through this herb.
So definitely, this Arka is one of the Upavisha in what we kept in Ayurveda as a two distinct categories of drugs, which have a very moderate to a higher range of penetrating capacity to enter deep into the tissues. And this entire plant, Arka, is used in various formats. Entire plant is used for making ksheera. Even the flowers are used. Even the seeds are used. Even the root are consumed. Even the latex is also used. So this is a very typical type of drug and a very useful one. And the name itself suggests it is Arka, somewhere related to the sun because of the penetrative and the sharp nature. This is extensively used in various ulcer managements or vidhrati, we can say, and even in the management of respiratory system related diseases, or it may be even the asthma conditions like, and even in the digestive disorders for the purpose of increasing the agni and improve the digestive penetrative capacity and secrete the more enzymes and juices which is suitable for digestion as well as, but of course it's always being a upavisha and strong in nature, it has a special capacity to cause some issues if it is goes beyond the limit. For example, if it is consumed beyond a particular dosage, then it because of its capacity of hotness and all the penetrative capacity, the tikshnata, it causes irritation in the mucous membranes as well as the soft areas of the body or where the tender areas of body, we may get itching or even sometimes ulcerations. We need to take care while using these. Of course, dosage is a very important criteria. Along with this entire plant is subjected for burning and it is being made into ash and it is washed to get the ksheera. And this ksheera is of a very good one, and even sometimes from the milk or the latex of this plant also is having a ksheera tattva. It is extensively used in the purpose of wound healing and particularly nadi vrana type of thing. I have made one combinations sometime back in one of my cases where there was a multiple nadi vranas were there. It is not totally a bagandhara, but you can get as a shataponaka bagandhara, something like that. So in that condition, there was internal openings and there was a connection between the things. So in that type of nadi vrana, I have tried with Ksharavarti. I prepared on my own Ksharavarti Varti. In that, I have used the ksheera of Arka, and this has given me a very wonderful result. And by very first application itself, the entire sinus granulation tissue, which is coming in the way of healing process, will be totally removed from the place, and it becomes a fresh, neat, clean wound, and helps in later very easily healing. So it's one of the wonder drug. Of course, with a very sharpness, just like a knife. We should know how to use it and where to use it. What are the precaution to be taken? It should not hurt us.
Thank you, sir. And coming to few details of it, this is quite commonly used in many types of swedas and also to apply as well. I think this, along with the nirgundi and castor oil, castor leaves are very frequently used. Like in the case of swelling, its leaves are collected and warmed, and it is a little sesame oil or any pain relieving oil is applied over it, warmed and then applied. So very good, not only for oral intake or in the form of ksheera, even the leaf as is also very useful, sir.
Definitely, it is very useful, but we need to be very careful while using this leaf. Just like a hot Svedana or Upanaha with this, but you should take care that it should not hurt the skin because it has a very strong nature. And we should be, we should use it with the caution that what type of people we can use it. For example, if a person is of Pitta nature, Pitta Prakriti nature, If it is in them, if you are using it, then there may be chances of ulcerations also. So that needs to be taken care of. But it is a very, very good pain reliever when it is made hot, the leaves, and some oil is applied, like Niruditella or even the Ksheera, something like that. Then over that, if it is a hot leaves are applied, the shota, the swelling very easily comes down. It's a very good one. But here to be taken, it should not hurt this. If this person is a sensitive skin and a person is belongs to Pitta Prakriti, it should be taken, used with a lot of caution.
Thank you, there, sir. And yeah, there are few remedies. These are few, this one. I mean, all this information is available in easy Ayurveda. Just this one. Interesting that it is used as Vamanopaga, but
One very important use, very common household practice, somewhat in the folklore we have seen, wherever something enters into the sole of the feet, to clear it up when it is not coming out easily, the people use ksheera of this arka into that area, and it has a enzymes which can easily break up the proteins nearby, and that's why it easily removes the foreign body which is stuck into the skin, which is not coming out. So that's why it's a common folklore practice. Whenever there is a such type of things, a thorn or something like that, which is entered into the feet, it is not coming out, and it is giving a lot of trouble. Then they'll apply the few drops of ksheera of this, and which usually very easily makes the things to foreign body to come out of the body. And next later, it also helps in easy healing.
thank you, there, sir. And moving on, it is because of its Tikshnata and all. It's straight out Katurasa, Laguruksha Tikshna, and Katuvipaka Ushna, like straight out. That's why it is so much aligned with the Ushnata that Pitta people should be taking care while using it. And yeah, it is told Ksheeramarkasya Vamanesa Virechane, but Charaka himself. But not so very commonly used for these purposes, right, sir?
The very simple reason is that it is just like a double-edged sword. It is so good in action, but also it causes side effects. When if it is just goes beyond your limit of dosage or any planning, something like that. And it is not such a type of drug which yields a result without giving any side effects. That's better you need to avoid it. And because of this complication little bit, many people or practitioners won't easily use this. When there is a better alternative for the woman and virechana, they don't go for it. Otherwise, the drug has a capacity, but provided that the dosage has to be very properly maintained. Otherwise, it is going to cause ulceration throughout the gastric tract, and it becomes another problem for us later to handle that.
Thank you, sir. And then it is used in Kusta, Gulma, Udara, and Deepana, Shotahara, etc. Mentioned flower is also mentioned for many different actions. And Kshara, we already covered. Tikshna and Gulma, Pliha, and Pachana, Deepana are the. Okay, so this one, in the Ksharavarti that you said that you prepared, apart from Calotropis, what other things you use, sir, out of curiosity?
This is a very typical combination I made it, which contains twak, the bark of cinnamon zailanica. It contained twak, and it contained areka nut, supari, areka nut, arpugafala, and along with that, haridra was there, turmeric, haridra was there. While the fine powders of these, I mixed it with ksheera of arka and made it into vardi. So by combining the powders of twak and betel nut and haridra, that is turmeric, and that fine powder is mixed with kshara, that is the ksheera of the arka, and made into a roll into vartis. So then they have been sun-dried, then they are kept inside the bottle and used fresh, because you cannot keep it long, because I now have not used any preservatives or anything like that, so I cannot keep it long. So it is as in now fresh it is done, maybe.
Thank you, sir. And you mean to say the cotton wicks were used, or the whole hair powder were made in the form of wick?
No, it is I'm rolled into just like a longitudinal pill. As per the requirement, size of the Niruha, I made it rolled into a wick like without the support. There is nothing, support structure over that is applied as a not like that. Entire thing is a wick. It has been developed just like the cotton wicks we prepare for Deepam. Similarly, it has been done.
The betel nut is understandable being astringent, and turmeric has wound healing properties. Like, why cinnamon?
Cinnamon is one of the best wound healer as well as antiseptic, and it causes a very clear sloughing out and removes everything from the wound. It makes the wound clean, and it is a very good wound healer.
Thank you, Desa. And probably being a Raghuram sir, please.
Question to Guraj sir. Wonderful preparation, sir. Sir, I would like to just know if there are any contraindications of administering this Ksharavarti, and have you seen any intolerance in patients, or is it like generalized as safe?
There is no any controversy, contraindications for this. But only thing is that it is being very sharp in its action. So what happens is the day one when we use this, the whole night the patient may have some trouble with the pain. So we already covered with the painkillers for that person. And when next day 24 hours he comes, sometimes the patient may develop even fever out of that temperature and these things. And once the sloughing is started, and when you open the wound, totally all those things, granulation, everything will be just melted and it comes out easily. So this happens in first 24 hours to 36 hours. This is what happens with the when we use this type of Varti in the Nadi Vranas. But after that, I don't use it. Once the Vrana is cleaned and neat and it is showing a healthy picture, then I go for just Pranavat Chikitsa, regularly dressing and feeling the things.
Okay, sir. How frequently or how less frequently it is used until complete healing is done? Maximum number of sittings for the patient. How many you have seen, sir, in your practical clinical experience?
So the case which I used with the information or the data from that case, I will tell you the information. I used in this case only twice. First day I used it, and next day when he came for dressing, there was a complete removal of the slug. Then second day also I used it, and next when we come from third day, it was almost a big hole, like entire thing was just came out, and there's only healthy red tissue was there, but the inflammation was there. So then after that I didn't use any Varti. Directly I went for the Jatyadikrita and all those things with the bandaging so that it can be healed easily. I didn't go for that. Only just one or two Vartis I used in each Chataponaka Bagandhara openings. Wherever there is opening, I use in one opening, one or twice only.
Thank you, sir. Thank you.
Yeah, interesting is that there is also a fumigation mentioned by Acharya Charaka himself with the leaves. I think this can be easily practiced. Alkalis are dried and burnt, and hemorrhoid masses are exposed to the fumes. It reduces pain, itching, and size of the pile.
Definitely, it works and it is practicable.
Yeah, and so Dhupana is one of the interesting use case of this Alaka. So there is a question here that in case of dysmenorrhea, can Arka with castor oil for fomentation be used over abdomen? Your thoughts on this, sir, please? Hello. Sir, the question, can you see it on the screen, sir? So can you use Arka castor oil fomentation for dysmenorrhea?
Definitely can be used, or it can be usable, but only thing is, observe where you are going to apply it. You are applying it onto the lower abdomen, comparatively always a covered area and a very sensitive area. And of course, you are doing it in case of females. So they are more comparatively sensitive than male. The skin texture is also like that. So taken all these factors into consideration, then you can use it for that. But we have got many other drugs for the better compliance of dysmenorrhea. Why you want to go for this? It's only a local things. And dysmenorrhea usually occurs in the very deep inside. You can go with other modalities to overcome the dysmenorrhea rather than using this one.
Thank you, sir. Even sometimes this ready-made liniments available, they also help in at least local application can at least help in reducing the spasm to some extent in case of dysmenorrhea.
Acharya Charaka's intention very clear. He says that whenever you do chikitsa, it should clearly remove the pathology, but it should not give rise to a new disease. So that's usually I keep it in mind when we treat any condition. Our intervention should not create something other unusual things. When we know this is a very strong and comparatively ushna and tikshna, it is better to avoid to applying these things directly onto those areas which are totally somewhat sensible areas, because that needs to be taken care. And usually the Arka these are things and applied as a lepa or something like that, particularly the joint related shotas. The area joint, it is comparatively stronger than the lower abdomen where we are planning to apply in case of dysmenorrhea, which may not be suitable.
Thank you, sir. Raghuram, sir, please.
In case of dysmenorrhea, I think, so to keep it simple, dysmenorrhea can be understood as being caused by the vata, which is governing the lower portions of the body. That's apana vata, to be very precise. So because all those activities which occur in the lower portion of the body, like defecation, urination, menstruation, everything is under the control of Apanavata. If there is no Avarana, so there may be some Avarana conditions also. So considering it as a simple a Vata condition, application of oil, so that is Abhyanga or mild Abhyanga or Samvahana over that particular area with any Vata Harataila, preferably even Pilataila also will do. Followed by hot fomentation. Nowadays we can go with hot bag fomentation or a cloth dipped in hot water in which salt is mixed. That particular fomentation also will do. If it is mild to moderate variety. So if it is severe dysmenorrhea and if it is occurring almost every month, so deeper pathology should be found out, Pitta association should be found out, Avarana should be found out and dealt accordingly. And for this to do, many measures need to be followed. So like the treatment should be done in the Avega Avastha, like between 2 cycles, appropriate time should be found out, and in that particular period when the symptoms of dysmenorrhea are not very active, that is the right period to address this particular issue, and also to take care of Vata or any associated doshas in such condition. Apart from that, the Virechana and also Vasti and Uttaravasti so will also help. So if it is of very, very, very severe, so this I'm speaking about the ultimate weapon, if it is of a severe sort, and some oral medications which can ease in the pain and also correct the mechanism of menstruation can be brought into practice, especially in the Avega Avastha. Vega Avastha is what I mean when there is dysmenorrhea and the woman is undergoing menstruation, dysmenorrhea, and the symptoms are very active. At that time, some measures to ease the pain should be done. If it is a very chronic condition and if the person is suffering from so many months or so many years, between 2 cycles where we get a gap, in that particular period, active treatment should be given so that the further cycles are eased.
Thank you, Dasa. Guru sir, please.
So we need to understand that what is dysmenorrhea is, which is in Ayurveda, it has been correlated to Kastartava. Particularly, the women in the entire cycle will not be having any dysmenorrheic thing. Only when it is started to flow, the menstruation, or just before starting of the menstruation, because this pain is developed or generated due to the separation of the endometrium from the, which is going to be shed out. That is separation is leading to pain. So if it is easily separated, then there will be no pain and it will goes off very easily. But when there is a dysmenoric conditions, because Vata instead of moving downwards, which in its Apana Vayu, it's moving in its Apana direction, instead of that it is moving in Udana direction, then it comes the problem. Then it's called as Udavarta or something like that. So that's the reason we will get all these type of unnatural pains during that time. So it requires a systemic management throughout the cycle. There will be something which can control or regularize the hormone levels and even the cycles. And during the period time, specifically the 3-4 days earlier to the period and during the period, so something about 7-8 days, that's the time we require particularly the muscle relaxants as well even antispasmodic type of drugs, that type of thing. And that can be achieved very easily. In most of my cases, what I use is Ingvastika Churna in a sufficient dosage with Sukumara Grita, which gives me a wonderful relief in all my cases. And many times I use that Menocramp tablet. It also gives very clear pain relief. Usually I started from 3 tablets per day, morning 1, night 1, afternoon 1, like that after the food. On the 21st day of the cycle till the 31st day of the cycle. So continuously you need to take it. So when continuously when it is taken, usually during the period time, the female will not have any problem as such. And she will have a very good ease menstruation.
Thank you, Dasa. Menocramp is from Soli milks and it contains Ashoka, Laudra, Ashwagandha, Haritaki, Parsikavani, Jatamamsi, and Gugulu. Thank you. Okay, so we covered that. And there was a question yesterday which we did not cover in the class. Was this is to Raghuram sir. Regarding the Anuvasana Basti, why it is given soon after food? It is told Ardrapani Avastha, whereas Niruha is given on empty stomach.
Why is Anuvasana done after food? See, Anuvasana Vasti is a type of Vasti wherein the oils and grutas, that is Taila and Gruta, so either individually or in a mixed proportions are used. Generally, for Vata conditions, for other conditions also, it can be given according to the indication. The question is, why is Anuvasana done after food and Niruha done on empty stomach? See, Niruha has moreover a cleansing activity. So apart from that, we can discuss a wide magnitude of actions of Niruha Vasti. Anuvasana Vasti also has a wide magnitude of actions. So like in general practice, when we see, these are used to balance each other. So like once Kashaya Vasti is given, so many practitioners practice, Panchakarma practitioners or Ayurveda practitioners. Once Kashavasti is given, it is altered with Anuvasana Vasti, so that Kashavasti might cause both are Vata balancing. So because Kashavasti or Niruha Vasti also has oil or ghee in it, the Sneha is there, but in a smaller proportion. The Kashaya and the other ingredients are also there. Apart from that, we have Taila or Gruta or Yamaka, according to our convenience, we have mixed in that. So there are different ingredients in Niruhavasti, and in Snehavasti or Anuvasana we give oil or ghee, again a combination of both. So many people have practiced Trivrut and also Mahasneha, like combination of all the four Snehas. So depending on the Yukti, the practice and classical references and the diseases which they are addressing. So generally, it is seen that Kashaya Vastis are very, very stronger. They may expel excess of doshas, and it may cause little bit of rukshata in the system. As a lubricant, the following day or the same day evening, some people practice Astapana in the morning, and that is Astapana. I'm using the synonyms. Astapana is a synonym for Niruha Vasti or Kashaya Vasti. Anuvasana Vasti is a Sneha Vasti. Again, it has many variants depending on the quantity what we take. So to provide lubrication and to control, if after Kashaya Vasti or Niruha Vasti, if there is slight rukshata increased, or which may lead to the aggravation of Vata little bit, though the intention of giving Astapana Vasti is not to increase Vata, if at all if it occurs. So to counterbalance it, the following day the Anuvasana Vasti is given. So then again the Kashaya Vasti is followed. So there is also a practice that people continuously give Kashaya Vasti or Niruha Vasti, but there is a general practice which has been brought into practice. Even the Shastras also tell it is better to alter Kashaya Vasti. So that is why we have the programming of Vastis, Kala Vasti and all those Vastis where different quantities of Kashaya Vasti and Niruha Vasti and Anuvasana Vasti are given one after the other. There also we see a sequence. So like Niruha is given, then Anuvasana is given, Niruha is given, Anuvasana is given in that particular order. So moreover, both have similar properties, both have Vata balancing activities. Apart from that, Anuvasana is a counterbalance which is given to the Niruha Vasti on the other day. So that is one of the properties of Anuvasana Vasti. So when we see Anuvasana is more over a nourishing type of Vasti, and Kashaya Vasti is more type of a cleansing type of Vasti. So now coming to this particular question after this small intro, Anuvasana should be done after the food, because once you take the food, what happens, it is there in the amashaya, that is the stomach and the upper part of the intestine. When the Vasti is given, when oil enema is given from the Gudamarga, its limitation will be to reach to the colon. So that is the most lower portion of the colon, that is the beginning portion of the colon, that is the large intestine. And it is not desired that the medicine goes into the small intestine, up into the stomach, and just guess, if the oil is going to the stomach, it may go in an upward direction and it may come to the mouth also, if the entire stomach is like empty. So when we are giving on empty stomach, there are instances when Anuvasana Vasti, when given on empty stomach, has given serious complications. I mean serious complications. In one of the case, so I don't want to mention where. So when I came into the teaching profession, I had heard that the serious consequence of giving Anuvasana Vasti on empty stomach took the patient to the emergency. And the modern doctors also screamed and shouted and said, what you people are doing, you people have created such a panic situation. The patient also went to coma. Okay, so that may be some cases, but definitely complications are due to happen. So because we need to follow the Shastra, we need to follow the methodology in which Ayurveda has explained. So here, the food becomes a barrier. The food in the stomach becomes a barrier so that the Sneha does not reach above that particular level, and it is not desired. It is also like Sneha Vasti moves very faster. So like it has a slippery action, and we are giving the Vasti in the sleeping position for the patient. And in the Paschat Karma, that is in the follow-up, we lift the limbs and do all those things so that the enema the oil enema reaches the entire intestine. So in that particular process, it may move too high. It should not move too high. And the oil or the sneha which is given in the Anuvasana Basti has a very quick movement. So it tends to pass very quickly and reach and cross that particular barrier of stomach and come into the oral cavity. Whereas the Kashaya Vasti, so when Kashaya is given, there is those who have experienced will know Sneha Vasti when it is given. So that is Anuvasana Vasti when it is given, the patient has comparably a larger tolerance capacity. The person can hold that oil or ghee for a pretty long time in the intestine. So in that particular time, if there is empty stomach, the oil creates mischief. Oil creates mischief and tends to move in an upward direction. So because oil enema is moreover lubricating, moreover it stays in the intestine for a pretty long time, and the patient can tolerate. Patient or a person who is taking Anuvasana Basti can tolerate and have the retention of Anuvasana Basti for a pretty long time. But it is not the case with Kashaya Basti. Now coming to the Kashaya Basti or the Niruha Basti, in which Kashaya is a predominant ingredient there, though I said Sneha or oil or ghee is also there in Niruha Basti in a smaller quantity, the large proportion is the Kashaya. So here the Kashaya is very Tikshna, that is very strong in action. Though by the time it enters the large intestine, many people will immediately have a defecation reflex. Many people will have a defecation reflex when Kashaya Vasti is given. So even before the Kashaya thinks of reaching the higher zone, it will come out. So here, the intention is the food should not be given and there should not be hindrance for at least the Kashaya to move to that particular extent. Okay, so the scientifically also we can see in different perspectives. I am just giving a classical way, classical experience, explanation so as to why these things should be given. So Sneha Basti should be given after food because we want a barrier there so that the Sneha quickly doesn't, because it stays for a long period and it shouldn't go high up. And Kashaya Basti, so because it should be given on empty stomach, so because we don't require a barrier there. We don't require a barrier there, and Kashaya doesn't move to that particular high up also. It goes inside, it's more over a cleansing, it mixes with the stools and also the doshas and comes out in a small quantum of time. Here we need to see that the person has less tolerance to Kashaya Vasti to hold, that is the retention. To retain the Kashaya Vasti, it is very, very difficult. So we need to encourage the patient to hold the Kashaya Vasti for a longer period. For Anuvasana Vasti, we need not. But it is also said that if Kashaya Vasti doesn't come out very quickly, so it also produces its own complications, and Sneha Vasti, we can wait till the evening for the Sneha to come out. But it is not the case with the Kashaya Vasti. So one thing is the food acting as a barrier or not acting as a barrier, wanting the medicine to reach. And also we want the Kashaya Vasti to at least reach the entire intestine and come back. So it has a quick action. Okay, so there we don't want a barrier. We want the free movement of Kashaya inside and come out. Sneha goes very slowly and retained for a long time. And if retained for a long time, tends to move in the upward direction very quickly due to its quick action. So that is why the food here is a barrier. And there may be a question, what happens if we do the opposite, like giving Kashaya Vasti after taking the food? Definitely there will be some complications. If we give Anuvasana Vasti or Sneha Vasti on empty stomach, definitely it will have its own complications. Those who have given, those who have experienced will know what complications it may be. Mild to moderate to very severe complications also may occur. So this is a small explanation there.
Thank you, sir. Guru sir, please.
I have my own understanding, maybe right or wrong, I don't know. See, Acharya very clearly, specifically told certain things in the concept. They have used that and they understood even the complications. Then only the ultimate gist has been given in the Samhitas. You need to do it in this way. Means they are straight away guiding us to go for a right path. So I take this information from the Acharyas as Aptopadesha. They very clearly said, Anuvasana, it is better to give it after the food. And Kashaya Basti in empty stomach. The probable reason may be from my intuitions and my understanding. I can give you my explanations. And if anything goes wrong, please correct me, Dr. Ram. This thing is what I understood is oils, whatever we give, it is having comparatively less saraguna when compared to water or a kashaya. Kashaya has very fast spreading nature when compared to the oil or a ghee because of its what you call gurutva or even saraguna based on that. So whenever we push a basti containing oil or a grita, it won't reach out up to the stomach. It won't go up to there because it will be comparatively. Even though we give it as some pressure, when it moves because of its stickiness of the oil or anything like that, it is comparatively moves to a particular level which is not beyond certain level. Whereas when you are pushing with the same pressure, the kashaya bastis, it tend to move still upward. So that's the reason there is a possibility that may come in contact with the food inside. That may be the reason that Acharya Suri said that when you are doing Kashaya Basti, don't go for a food. I mean, there should be empty stomach. And when you are doing in Sneha Basti, it is better you can have it done after the food. So maybe this is one explanation or one type of explanation for this understanding.
Absolutely, absolutely, sir. So that's also logically really apt. Like kashaya may come into contact with this one. So like we don't have true theories why, as Guruji sir rightly said, what Aptopadesha or whatever has been said in the Shastra is correct. And regarding the Sneha and also the Kashaya reaching, yes, Kashaya, as I said, it has a very quick action. And probably Sneha, as Guruji sir said, it may be right. Sneha stays long and it moves slow. Kashaya, that's what I was telling. Sneha stays for a longer time. So even if it doesn't come by the evening, more. So unless it creates some complications, nothing to bother. So and Kashaya, it moves very quickly. So because and also when we see Anuvasana Vasti and Niruha Vasti, the Niruha Vasti quantity is more. The Niruha Vasti quantity is more. As Guruji sir said, it may move quickly upwards and come in contact with the food, and it may move towards the mouth also very quickly. So, or it may create vomiting sensation and other things. So, what I have experienced or what I have heard some physicians, some senior physicians tell about the Sneha Vasti is when it was wrongly or accidentally done on an empty stomach. The Sneha Udvega, just like we take Sneha from the oral cavity, so like in the Snehapana, the person will have the sensation of puking. So that is why we are given some hot water and other things to specify that particular effect. So in comparison to the Kashaya Vasti, so the person experiences that Sneha, somewhat Sneha moving towards the mouth or quickly moving towards the mouth. That sensation may be there without if the food is not a barrier. So that is why food is a barrier. So that was the concept I said. And Guruji sir's explanation is also very scientific. Like if Kashaya Basti, which is large in quantity, moves very quickly towards the stomach, it may come in contact with the food, or it may push the food upwards and cause nausea and other symptoms. So that is also scientifically accepted and appreciated, sir. Thank you.
And to clarify, I mean, the Kashaya Basti being a combination of honey, Makshika, Lavana, Sneha, Kalka, and Kwata, overall, it can be slightly more viscous or thicker when compared to the oil or ghee, which is given in lukewarm condition and added with little bit of Sandhu Lavana in some cases. And also the purpose of the Sneha or the area of action of this Sneha Basti is mainly the large intestine, and it is not like yeah, it can reach up to the stomach, being it can being spreading in nature and all that, but having food in the stomach will give a sort of a signal to the intestine not to carry anything in the reverse direction. So that could also be the reasoning. And coming to a few questions on this topic here. What kind of food is suggested before Anuvasana Basti? For that, I quoted the Sushruta Shloka itself. It says, Na cha ati snigdam ashanam bhojayitva anuvasayet madam murcham cha janayat dvida sneha prayojita. Means too oily food should not be taken, should not be given ahead of Anuvasana Basti, because Ayurveda categorically advises to avoid sneha prayoga or two different orifices. So this can be intoxicating, and patient may also feel fainting. And also, ruksham bhuktavato hi annam balam varnam cha hapayet. If too much dry food is given, it beats the purpose of making the kosta, bringing the snehata to the kosta. It can also decrease or deplete balaya and varna of the patient. And in the same sloka, he goes on to explain, this is like ideal food. Yukta snehamato jantum bhojayitva anuvasayet. Means yukta sneha, the commentator gives the meaning as alpa sneha. So the food that is given ahead of sneha bhakti should have alpa sneha. And Yusha Kshira Rasa Rasa Tasmad Yatha Vyadim Samikshava. So based on the disease, it can be soup, milk, medicated milk, or even meat juice, etc. Yatochitam Padahinam Bojayatva Anuvasayat. So it should be three-fourths of the quantity of the regular food. It should not be up to the full stomach. So these are the guidelines given there. I've noticed that Matra Basti have reacted low Agni in patient. Why did this happen? As I learned that Matra Basti is very safe to practice and have lowest risk.
In type of sneha basti, so as I said, there are many types of sneha bastis. Matra basti is one basti which is used in smaller quantity. So here generally the person should have intolerance. So when there is kapha varna or the meda varna, so when there are certain things coming into the way of the basti, like similar materials of the oil. In Matra basti also we are using oil or ghee, no matter. So we are using in a smaller quantity. But we need to see that certain body tissues have similar properties like that of sneha, like oil or ghee. So example, kapha, meda, all these things, especially mainly the kapha when we are speaking about the action of vasti here. So if there is a kapha varna or there is excessive kapha, if there is excessive ama in that particular condition, we haven't analyzed the condition of the patient properly. Okay, so if there is already an indigestion to that particular person, so in such conditions without analysis, and we also have arha and anarha, so like eligibility and non-eligibility, which without looking into the proper eligibility of the patient to take the vasti. So though this might not cause in many cases, like oral snehapana, what we do know. So when we take sneha, so or the medicated ghee or oil through the oral route, it may act on the agni, so directly. So but in vasti, the action on the agni will be indirect. In spite of that, if the person is feeling some indigestion and indigestion related symptoms, that means to tell that the person was not eligible to take the matra vasti, though in a small quantity, or there may be a small intolerance, or it may be an initial reaction on the first or the second day. It may get right on the other day. So when the kashaya vasti is given on the following day, those things may be corrected by the time the second sneha vasti is given. So generally, it is a practice that matra vasti without kashaya vasti, it is given almost continuously, like daily, because it is given in a smaller dosages, or continuously giving matra vastis on consequent days. So that might also have come into the way. If not, the kapha and the other materials which are interfering with the mechanism of matra vasti, or the physician has done some error in calculating or estimating quantity of matra vasti, or choosing the patient according to the eligibility and non-eligibility. So these are some of the conditions, or a climatic conditions, so where there is excessive cold, shita kala. In that particular condition also, when matra vasti is given, or if matra vasti is given to a person who has taken snigdha ahara, so like food which is having oil and ghee in excess, or previous day the person has taken a plenty of food which has plenty of oil and ghee, or some fried foods or something. So in all those conditions and many other conditions, many things can come into the way. So these are some of the conditions we can consider why there may be intolerance or indigestion and indigestion related problems occurring after matra vasti, which shouldn't occur generally.
Guru sir, please.
With respect to this question, I noticed that the patient was having low agni, that person Matra Basti was given. So there is clarification. Second thing, Matra Basti is usually given a dose of 30 to 50 ml to a maximum. And that I have given to various type of Prakriti persons Matra Basti. Not a single case I have come across any unusual things that patient may develop pain, as patient said that his agni has gone down, or he is feeling somewhat. No, nothing. And of course, it is even the experts who those doing matra feasible, and that's the reason it is said matra basti can be given in any time. It may be after the food, even it may be before the food, anything, because the quantity of oil or the sneha what we use in this is very less. place. That reason, I don't think so it is going to cause any issues. Maybe it's in coincidence observation what they have made, what I feel.
Thank you there, sir. And out of say 30 ml of this one given, was there any, have you come across any study on like how much gets absorbed and how much gets eliminated? I know it's a very tough thing to measure because
Yeah, not exactly, sir. I have not come across how much it is absorbed and how much it is. So not sure about how much, if at all, if it is absorbed, how much it is absorbed. I don't think I've come across some studies like that.
And is lower abdominal pain?
How you are patient?
Yeah, it's difficult. Difficult tending towards.
See, once after the matras is given, we need to ask the patient to pass the motion in a particular vessel or something like that. Then we can try to measure. But while measuring also, how to separate the sneha from the other secretions of the colon, or even the stool portion or the food portions. It's very difficult to segregate them. It is not possible technically.
Yes, but separating the fat portion from the feces is possible. I've seen a medical study, clinical study conducted in some Western country. I think there is a documentary on that is also available, where they studied if yogurt decreases or increases the amount of fat that is eliminated through fecal matter. In that, two groups were there. One was given yogurt and another one was not given yogurt. They were given very similar type of foods in terms of oiliness, oil and fat, etc. Everything is measured, and the fecal matter was collected on a daily basis, and they separated the fat from the fecal matter and measured from the different group, and it was observed that yogurt group was eliminating more sneha in the fecal matter. Okay, so and moving on to some other questions. I noticed that after Anuvasana, Basti, for a few days, the dryness of the skin reduces. Yeah, overall snehana is the purpose of it. So in Basti, the idea of delivery of herbs in oil and not the oil itself. So Raghuram sir, what is the purpose of Basti? Is it just a lubrication or pacification of Vata symptoms caused by Niruha? Or does it have its own medicinal values?
So Anuvasana Basti has a wide spectrum of action. So as I already said, wide spectrum. It is not just for lubrication. It is not just to control. So because we also have Vyadhihara Bastis. So specifically indicated not only to the doshas, but also the Vyadhihara properties. Dosha Pratinika, Vyadhi Pratinika, both it is there. So they are meant to control Vata, and also associated pitta and kapha, depends upon what type of oil or ghee we are using, with which dosha specifying medicines they have been processed. Number one, not only the dosha control, so they also very much to eradicate the diseases for which they have been used. For example, let us take Pakshagata or Pakshavada. So there is hemiplegia, such condition, or a simple painful condition like a Sandhigata Vata. So like Vata symptoms increasing in the joints of the body, leading to painful conditions. So we have seen that even Matravasti, even without Kashayavasti, if it is given Matravasti on a continuous regular basis. So the pain and related symptoms. So this shows when the pain and other symptoms of Sandhigata Vata or the movements in Pakshavada improve, that also shows that it has a Vyadhihara property. So like oil or ghee. So definitely, apart from being a lubricant, apart from being a dosha specifying or a dosha balancing effect, they also have more reach. So like they can eradicate the diseases also. That also shows that Pakshavada was caused by Vata, and that also shows that the primary control center of Vata is Pakvashaya. So like the colon. So that is why when the medicines are given through the Vasti, they are the best in controlling the Vata related diseases and Vata related conditions. So we also know that there are Vastis which are given for Pitta and Kapha in those conditions, or association of Pitta and Kapha with Vata, some sort of doshas. So to conclude, Anuvasana Vasti has a broad spectrum action apart from lubrication and also the dosha specifying action. Extending this explanation to Astapana Vasti also. Yes, Astapana Vasti also has a similar magnitude of action. Moreover, cleansing in comparison to the Anuvasana. So Anuvasana, moreover, a lubrication and nourishing in comparison to the Astapana. Both hand in hand There, it is a magnificent treatment which Ayurveda offers. That is why Ayurveda has said that Basti is Ardha Chikitsa. So it is half of the treatment half of all the treatments given are available to treat all the diseases. Vasti becomes half. So when we put Vasti or enema, the medicated enema, Astapara plus Anuvasana, Niruha with Snehvasti on one side of the balance, and on other side, we keep all the other treatments on another side. So Vasti will always have an upper hand. And this also justifies that Vayu Tantra and Tridraha concept, that Vayu is the formulation or the formula in the body which controls all the mechanisms, including the control of indriyas, controlling of manas, and controlling of other doshas, dhatu, everything. So Vata is the prime factor. So Astapan Vasti and Anuvasana Vasti have broad spectrum action. Put together Vasti, when we consider, or the Basti when we consider as a single unit, it is Ardha Chikitsa, half of all the treatments.
And also the ways in which the Basti acts cannot be like, I think it's explained as achintya also. And one of the reasons, or one of the ways in which it could be acting is like restoration of gut microbiome, which is one of the main reasons for many autoimmune disorders. And autoimmune disorders, out of all many disorders, is one of the big indications for Basti Chikitsa also.
Thank you for answering the question. But what I'm trying to really understand here is, say, if we have this 30 ml of Matra Basti that has all the herbs in it, what I'm trying to understand is how much of it, I know that the answer that how much of it is absorbed or how much of it is left out is very difficult to gauge. But what I want to know is how much is really giving so much relief. So what is it? The herbal component in that, because the oil seems to be too less. The 30 ml seems to be too less for the length of the colon, and to make any kind of, it at least seems like to make any kind of big difference, the amount of oil seems to be less. So is it the combination of the oil and the herb, or it's just absorption of say 5 ml or 10 ml is really good enough to give so much of improvement? Is my question.
So very clear. In Matra Basti, we are using 25 to 30 ml or maximum to 50 ml of oil. And that oil is not simple oil, it will always be medicated oil. So it will have the something like that. You are able to fly, and along with that, you have a capacity to strike. So if these two things are combined, then that is called the medicated oil. Vata has Ruksha Guna Pradhana. Along with that, it also has many other things. So when only Kashayas are given, which is the divide of Snehatva, so it is again as the Rukshata, I mean again as the Sneha. So whatever the continuously, if you give Niruha or Astapana, Basti, or anything as a Kashaya, then there is a chance of reduction of Snehatva locally in those colon area. And the colon area is being the center for Vata control and Pakvashaya. We need to give something which is in the form of Sneha. So that's why the capacity of the herbs which are able to act as Vatahara, they are being combined and developed into such an oils. Those oils are given. And when we give only 30 ml to 50 ml, our intention is just to cleanse or correct or stabilize locally the Pakvashaya. That is usually in the upper or transverse or middle colon, and it won't usually go beyond that. So intention is very clear to improve the things at the very center where it is. Intention is not going to cover the area of the colon. It's only the locally in the large intestine to some extent that, and which is a clear lubrication and brings down the Vata. When centrally when Vata is controlled and brought down, automatically it has a profound intention to cover it. Because whenever we give Madhya Basti, before that we are not going to evaluate a person that whether his colon contains anything other than that. Whether he has consumed any other oils or something, whether it's a food or maybe in the form of medicine. What is expelled? Maybe he may expel totally after 2 minutes, or maybe after 1 hour, half an hour, may not be expelling totally. Then how to evaluate? Then how to bifurcate is a snare to present that it is only from the oil which is given to in the form of Matrasti. It becomes not a lot of, but well, in Matra Basti, the quantity of Matra Basti itself is a lesser one, and definitely what amount of is the thing understood that it is absorbed, it's also comparatively lesser. Many times, gas is very much catalytic in nature. It improves the functioning of water. And the body, in order to keep all our pathways, the maras, the sutasis, And because Vayu is the one which is able to carry the function and throughout the body, and the other two things, Kapha and Pitta being a Pangu, they are lame, they cannot move by themselves. Vata is required, and definitely this Vata will help to recover all these things. That's the reason Matra Basti is given in a small quantity, locally it is absorbed, and centrally in the Pakvashya, where it is a Mulasthana of Vata, that is stabilized. So for that purpose only it is given. Our intention of giving Matra Basti is not to extend beyond the certain limit, but when the central is controlled, automatically the periphery also gets into control.
Thank you, sir. And there are a couple of more questions regarding Crohn's disease. So with that, we come to the end of this session. I thank you all the participants for your interesting questions. Namaste.